right, so welcome everyone to this second project update webinar of the project we call Enhancing DHIS2 for Campaigns. So this is a collaboration between the HISP Centre at the University of Oslo and Clinton Health Access Initiative together with other partners in the campaign space to improve the use of DHIS2 for campaigns. So what we like to do is to have a few of these project update webinars just to show, some of the improvements and developments that are happening around DHIS2 for campaigns, and also share some stories from the field. So my name is Caroline Tuftelien, so I'm one of the DHIS2 product managers at the HISP Centre. So today's agenda is we'll kind of do half and half. So the first half will look a bit at these enhancements that have been done in DHIS2 to help for campaigns. So I'll do some demoing on some new features and functionalities that are available or will soon be available on the DHIS2 platform and in the apps. We'll talk a little bit about what we're doing around also documentation and guidance, some more toolkits and documents and tips like that to use DHIS2 for campaigns. And we'll also give a bit of information on how you could help test these features and functionalities and provide input on the features as well as the documentation and guidance. And then part two, we'll get a couple of presentations from our partners. We'll hear from Malawi and HISP Unima and the malaria control program there, and then we'll hear from Uganda and our partners HISP Uganda on how they've been using DHIS2 for sustained campaign use. So as I said, the point of this project is to kind of look at software enhancements as well as documentation and guidance. And so what I'll do is I'll demo a few different functionality, and we'll sort of split them up into these larger categories that we call collect, analyze, and configure for this presentation. So basically improvements around collecting data, improvements around analyzing and visualizing data, and improvements around configuring the system. So while presenting, so first we'll do the collect functionality. So while presenting, we also want to give a little bit of background on kind of the initial challenge or requirements that came up for this functionality. We've gotten a lot of great insights, requirements, needs, challenges from our partners working in the campaign space. And then we've used this to see how we can improve the DHIS2 software. So one of the issues we saw were around the GPS accuracy and the Android capture application, how there was little control over the accuracy, the ability to have insight when they were capturing the coordinates, to be able to have some accuracy thresholds and other information around that. So for this this first demo of the feature, I'll quickly turn over to my colleague Nancy, who's also a DHIS2 product coordinator, and she will present this particular feature. So yeah, over to you, Nancy, if you're ready.
Yeah, let me just share my screen. Let me know when you can see it.
Yes, looks great.
Perfect. So yeah, as Carolina mentioned, in 3.1, we introduced this new feature called GPS capture accuracy. And the idea is to ensure that the location information collected is precise. So I'm going to be demo here. I have 3 different tracker programs in this, at least in this first version in 3.1, we are only allowing that to programs, to tracker programs and not data sets. But in future versions in 3.2, we will also have the accuracy in data sets as well. So I will be using these three programs just to show you the different combinations that you could do using the GPS accuracy. So for the default one, I'm going to be using the child program. So if I enter the program and then let's see, I will enter a new one. I will create a new person. Then I have in this case, in this particular case, I have the enrollment coordinates. So if I tap on add location, since it's the first time I'm entering to the maps, it's going to ask me for the locations device. And I will say, while using this app, then if I tap on my current location, you'll see here, hopefully you can see it in the screen, there is a loading icon that it's eventually going to show a label. Let's just wait a second for it. It's going to show a label with the accuracy, the level, and also will show a tag. In this tag, we have been divided this tag into 4 categories, which is low, medium, good, and very good. Low being greater than or equal. Oh, sorry, let me check here. Okay, let's try this again. Give me a second, sorry. There we go. So I've been playing with this, removing the axis. Maybe that's why it wasn't loading. But as I was mentioning, the accuracy range is showing the level and then a tag, low being greater than or equal to 100 meters, and then it goes to medium, good, and very good, which is less than 6 meters. When it finally reaches the 6 meters, it will say very good here, and then it's just showing the label for the user to wait. And in this particular case, this is the best accuracy we could get. So it's 100 meters, which is low. But even though it is telling me that it's low, I can save it. But as Caroline will mention, we have two different settings that an admin user can use to make this even precise, or to make this capture collection even precise, which is you can set up a minimum required accuracy for the capturing location, or you can disable the manual location. So something I can show you before moving to that is that if I move directly, if I'm starting to swipe to a different location, then I lose the accuracy range. Why? Because I'm selecting the exact location that I need. So instead of showing that, it is showing the latitude and longitude directly here, and you can save that as well. Or I can use the search bar here and search for a specific location that I need to go to. This is because I'm allowed to do a manual capture of the coordinates. So if I go to the Android settings web app, and if I go to appearance, I need to go to specific settings. I have already set up these two programs, which are the two programs that I have here: the malaria case diagnosis and the malaria focus investigation. For the malaria case diagnosis, if I open it and I go to the capture coordinate settings, which is the ones that I want to use, I have disabled the manual location, and I also have a minimum location accuracy, which the preference, or the ones that we usually recommend is 5 meters, but for this particular demo, I'm going to be using a very low minimum location accuracy. So in this case, we have both disable manual location and a minimum location accuracy. So if I go to the program, which is malaria case diagnosis, let me just open any record. And in this case, instead of showing this, I'm going to show a track entity attribute, which is this one, a GPS attribute. If I go here and tap add location, then again, it's showing me the 100 meters, and it's trying to reach a better accuracy. But if it's not allowed, then the done button is enabled. And I also don't have, even though I can move, I cannot select, as you see here, I cannot select any other location, just the current one, and I cannot search. So the done here won't be enabled until I reach the minimum accuracy. And if I don't reach it, then maybe I need to move a little bit, or maybe I need to wait a few moments and then go back and try to capture it. And then I have the other program, which is malaria focus investigation. And in this case, I have disabled the manual location, but I have not set a minimum location accuracy. So if I go to the third program in here, sorry, I will open. Let's go. In this case, I'm going to be using a data element. So the same applies to a data element. So the main difference is that even though I don't have a minimum location, I do have a disabled manual location, so I cannot search. Even though I can move, I cannot select any other location, but the button is enabled because I don't have a minimum location accuracy, so I can save it. Okay, so I think that's it for me. If you have any questions, I will be answering in the chat. Sorry.
Thank you so much, Nancy. And as Nora was saying, if there are no hiccups, it's not a real live demo. So thanks for. Let's see if you got that out of the way and what happens to mine. But thank you so much. And yeah, please ask questions in the chat. So I will go through a few other functionality that has been added to the platform recently. So again, we're still on kind of things for collecting the data. So one of the things we want to show is that in the Capture web app, we've added some bulk simple operations, specifically around completing and deleting. And we feel like the requirement here was that it could facilitate campaigns. If you could bulk complete, relevant events or enrollments related to a specific campaign or intervention after a campaign is completed. So I'm now in Capture app. Let me know if you don't see that, but I should be sharing my whole screen. So for example, if I go to this SIA Rapid Convenience Monitoring, you see that there's quite a lot of events with the status completed here. But if I go, for example, to active events, you see we have this bulk kind of checkbox here. What I can do is I can check a few or I can check all. And you see you get these actions here. You can complete or delete. And I can say complete events. Are you sure you want to complete all the active events in the selection? And I can say complete, and they will disappear from the list. You can, of course, also filter on other things here in this working list and decide what you want to filter them on and then complete and or delete. We have the same functionality. This is an event program, and we have the same functionality for the tracked entity list as well as the program stage event list. I also want to very quickly show something that's coming up. That is, we currently only have a prototype for, but it's currently in development. And this is something we are calling row-based data entry. So the requirement here is, if in a campaign, if a lot of children have received similar vaccinations or households have received similar interventions, a way to enter the data, and if the same data even for these would speed up and really expedite data entry. So quickly to show in this prototype, which this prototype specifically is showing TB. we are thinking of ways that you could sort of bulk add values. So each of these rows are a tracked entity. You see different kinds of data elements over here. And what we're looking at are ways that you can either copy all the values in one row to another, or you can click sort of the column and say apply value to column cells, and then decide which one should be applied to all, and then it will actually do that. So again, this is a prototype. It's something that will come later on, but I wanted to also showcase that that's a really exciting functionality that's coming up soon. Let's now move into a few of the features around analyzing and visualizing. So one of the things that was one of the kind of original features in when we started this collaboration was that there's no way of disaggregating data by option set in the data visualizer. So option sets are used for a variety of things like classifications and treatments, but you can't disaggregate them in data visualizer. So let's have a look at how this can now work in the data visualizer. I will just do this month for now. So what we've done is we've added a way to disaggregate by option sets for the event data items. So if I, for example, go again back to this SIA program, and I decide, and so the ones with option set will have this little icon. So for example, I want to do a source of info campaign, and I can click here. And then you get all the options in this option set. So I can decide, for example, okay, but I only want to see the ones where community health workers and radio was selected. It's a bit, the reason it's showing this is because the aggregation type for this data element is currently none. But we have in Data Visualizer, you can always override the aggregation type. So if I instead say sum and update, then you'll see the sum. One of the reasons we think this would be very helpful is for those who might not have access to program indicators, for example. So let me just show you quickly. If you compare with the actual program indicators for this. There you see that you have this one. Do you see this is called program indicators? We've added this. I'll talk a bit about this info button in a second. But you see that this is the program indicator. And then we do the one for radio. Then if I update, you see that they have the same number. So it's the same data, but then a person wouldn't have to create indicators, or if they don't have access to indicators, they don't have to do that. The next thing I wanted to show was what I just mentioned with the data definitions that we've added. So let me just quickly search for one of these things. So we, for example, have this one that says it's an indicator. If we click info, you're going to get a lot of information here. You're going to get the description, the expression, you know, what groups they're a member of. And if I, for example, see, oh, I want to look more at this numerator expression, I can also look that up. And then you see this is a data element, and then you see what data set it belongs to, you see the value type, the aggregation type, even the category combo, etc. So just to go back to the presentation, we believe that's a great way for users to really see the meaning and setup of data and to be able to interpret that fully. Then we have the dashboard that we've added sort of this presentation full mode. So what it says here is slideshow. I will say that it does not autoplay. Hopefully you'll still see this full screen. Let me know if not. And then you can just tab through the dashboard in full screen. I feel like this would also be very helpful when you're having, for example, kind of review or evaluation or planning meetings. And then let's see what is next. Quickly, just mentioning, we don't have a demo for this right now, but coming soon will also be the possibility to use your org unit data element to make maps, not just, for example, the event org unit or the enrollment org unit, because a lot of times you might use the organization unit data element type to record other types of locations, for example, source of infection, etc. So this will be a way to make both thematic apps and event maps for that. Then we go on to configure, or maybe, yeah, configure and maintain. So what we're really looking at, and I think unfortunately in the interest of time, I'm not gonna do this whole action, but I'll explain it, is that we're looking into metadata deduplication and merging. I mean, we see that a lot of implementations might have a variety of duplicate and overlapping, for example, indicators, data elements from different rounds of campaigns with no way of merging it. So we're adding the capabilities to merge a lot of different metadata, including data elements, category option, categories, indicators, and more. So this is an example of how it looks with the configure category options. You choose your source indicators, and then you choose the target indicator to which you want these to be merged into. And you can decide to keep or delete the source indicators. We have this extra security measure, just to add this to confirm that you actually want to do this merging. You have to be a system user to do it as well, because it's something that we don't think everyone should have access to, but we think it'll be a very nice enhancement to people who are managing metadata. So went very quickly through some of these. Everything is being recorded, and we will share the recording after, as well as some ways for you to test and give feedback. Before we go on to the partner presentations, I wanted to quickly, again, just recap some of the improvements we're doing around documentation and guidance. So we have a lot of existing documentation that was done for the SIA's campaigns, but we are looking at expanding and generalizing that a lot, and again add a lot of the new functionality that has been developed throughout this project, and configurations and best practices around that. We're looking at expanding guidance on microplanning specifically with more of the geospatial capabilities that we've added in recent times. And we're really looking at documenting use cases on all types of campaigns, including, seasonal malaria prevention and ITN, IVM, everything really. And on that, we are also, in terms of partner input, we really want to hear from you. We know there's a lot of great guidebooks, toolkits, etc. out there. So what we are really thinking of is what are topics that you want in this DHIS2 specific toolkit? So what are specific DHIS2 features you want more information about around campaigns? Any configurations or workarounds that you often encounter when conducting campaigns would you like to know more about? And yeah, again, specific use cases you would like some examples of. So stay tuned for a survey to provide a bit of input here. It will be very short, but we want some more input from partners there. And then we would really love more use case examples, especially around the use cases, supervision, attendance, and payments, where we're really interested in seeing if and how people might have utilized DHIS2 for these. So we're looking at providing some draft guidance for partner review sometime in early Q2, but we'll again keep you updated on that. So then, I think we'll move straight into the kind of our partner campaign implementation presentations. So the first one will be the Malawi National ITN distribution campaign. If Ramsey and Austin, so Austin Gumbo from the National Malaria Control Program and Ramsey Niema from HISP Unima. Do you want to share your screen yourself?
All right, thanks, Caroline, for the great presentation and for giving me the stage to sort of just share our experiences with regards to like using DHIS2 for campaigns. So thank you, everyone. So I think Caroline has already done much of the groundwork by introducing us. So I here on behalf of like HISP Unima or HISP Malawi in other terms. So we just here to just share our experiences on how we went about like using DHIS2 to support the digitalization of the ITN mass campaign that started some year ago in 2024, but it's currently ongoing. So we expect that by March or April, we should be wrapping up with the campaign. So I think as you might have known from your various countries and those that are especially burdened with malaria, one of the ways through which the burden of malaria has been addressed is through the use of ITNs, which are distributed every 2 to 3 years. In our case, it's every 3 years. And this time around, the National Malaria Control Program thought it wise that they should digitize the system. And that was based on the premise that we have been implementing a nationwide community health information system. So that sort of seeks to integrate the services that are offered at community level. So at this level, the point persons are what we call the healthy surveillance assistants, which have then gone on to register like the households in the administrative area, in the catchment areas, and in districts where we're already implementing ICIS, we saw it wise that instead of implementing a totally new tracker program altogether, we just leverage on the structures that we have already built and on the data that has already been collected. So for that reason, we just extended upon the functionality of the community health information system that we had and incorporated the issue to do with like registering the households into the ITN registry and streamlining every other activities that are in the campaign through the household register. So this household register is like a tracker program that initially was just assessing like household level community services, such as watch services. And we then just extended the module and included an ITN registration program stage, as well as an ITN distribution program stage to this workflow so that the data that had already been collected on households should not be duplicated. So the general workflow of the implementation is as the picture shows, where we have like 4 main components, I would say, where the first one is where the HSAs do rounds in their catchment areas and sort of just register the households that they have. In the process, I'll be correcting like the household head demographic information. And once the household details are captured, such as the population, they then issue voucher cards, which specify like how many ITNs that particular household is supposed to receive. And need I say that these voucher cards are manually written. So these are like hard copy voucher cards that are issued out to the potential beneficiaries so that on the day of distribution, they should come with these voucher cards to sort of certify them that they were indeed registered. And after the HSAs have done their rounds of registration, that's where now supervisors come in. So how we implemented the workflow that supports supervisors is we created a separate program stage that was only accessible by supervisors. So we had a special role for supervisors and a separate role for like the HSAs. So they had a community tracker role, whereas the supervisors had like a supervisory role. And only they could have access to this program stage. But this program stage was associated with the household register. in such a way that after the HSA has done the registration, the supervisors would then do like a roundup of some of the households that the HSAs had registered. So they would sample out some of the households that had been registered, and then they would attempt to do like a brand registration of the households. And what I mean by brand registration is that at this point of registration, the supervisors had no idea of the information pertaining to ITNs that the HSAs had collected, because HSAs were supposed to collect like the population of the household. And based on that, that's when the system was supposed to calculate how many nets have to be allocated for that household. So this is the first part of supervision where the supervisors were just coming in to ensure that there was consistency of data entry. And if it was noted that the data that the HSA collected and the data that the supervisor has collected, there are mismatches, the households were flagged, and then they were reported to the HSA to then do a mock-up exercise. And then after this mock-up exercise was done, we were then assured that at least part of the data that has been collected is consistent and is clean. And this then translated into the next step of the exercise where the district support teams were now trying to come up with like the logistics plan to inform the logistics service providers on how many ITNs have to be allocated to the various distribution sites. So the approach was that the registration was done door to door, but the distribution of the nets was done at a center point of like 3 or 4 communities. So 3 or 4 communities would come together, and then they would get the ITNs at a centralized position. So the logistics plan just sort of informed the logistics service provider on how many nets have to then be associated, have to be fed to the distribution site. And then on the day of distribution, the beneficiaries would then cluster at the distribution site, and they would report with their voucher cards. And the HSAs that were responsible for the various beneficiaries could then hand out the nets. So one of the things that we did encounter was that after the registration, we did note that the ITNs that might be required for a particular area might have exceeded what had been planned during micro-planning. So one of the activities that preceded the whole exercise was micro-planning, where NMCP engaged the various district personnel to plan for how many ITNs they might require, and also plan for the human resources, like which HSAs are serving which catchment areas. And that also assisted the digital support team to allocate the HSAs to their respective catchment area organization units, so that they were only reporting for their organization unit. So I think what you see on the right is just like a brief rundown of the various parties or stakeholders that were involved in the actual exercise, where we had the National Task Force team supporting the district supervision team, which was which comprised of like the HSA line supervisors. These line supervisors are the ones that were responsible for the actual validation of the data that had been collected by the HSAs. So I'll now move forward. So as I mentioned, the supervisors were able to validate the data that was collected through a program stage that was specifically configured for supervisors. And in addition to that, we made use of dashboards for each and every district that we were rolling out the campaign to, where on a daily basis or at the end of the day, they could be able to know which catchment areas or which healthy facilities had actually synchronized some data. So that also helped us like assess the performance and also just like track the general progress of things, and also like note out any challenges that might have been occurring, such as syncing issues. Because if we did note that for a number of days as the campaign ensued, some catchment areas had not yet recorded data, then it was a call for action to sort of just follow up and see what exactly is going on? Do they need some extra support? And where need be, there was assisted supervision that was provided by the supervision structures. And above that, we also made use of like a line listing, because I did mention that we had to prepare like logistics plans to inform how many nets had to be allocated to particular distribution sites. So we made use of line listing where we're able to, one, export the data, and then off band, we were then able to like make aggregates of how many nets were required to be handed or to be issued to every HSA. And based on like the micro planning forecast, or based on the supply, there was need of rationing that was supposed to be done. So the line listing did help us to even do the rationing up to household level, where if a household was, for instance, allocated to get 3 nets, based on like or influenced by shortage, they could get 2 or 1 nets. So there was a lot of capping that was done, and that was due to the shortage of ITNs that we had in stock. And then above just the general supervisory roles, we also like had like a centralized issue tracking spreadsheet, which was used for like documentation of any occurrences or any noteworthy events that might need to be followed up. And the various personnel that might need to respond to that would respond to that in kind. So there were issues such as maybe somebody was misallocated their catchment areas and they were reporting to a long catchment area, or they were allocated to a different facility from their own, or they had done some actual migration within the course of the exercise. So all that was tracked in a centralized spreadsheet, which was off band, off the DHIS2 domain, of course. And then, as I mentioned, there was sort of like a data validation exercise that the supervisors were really responsible for. So the output of that would more or less look something like this. And as I mentioned, this exercise was sort of like a sample-based exercise where they were only able to sample out a few households, and then from the few households, once they did like the re-registration, they were then able to see the deviations or anything that might have ensued. So there were a number of things that they were looking for, and sort of like a sample report would look like this, where even some challenges that were encountered during the supervision could also be noted down. And some of the challenges might also be down to the fact that the HSAs that some of the HSAs that were in the employ might not be as digital savvy as younger or more energetic HSAs, which is why there were data inconsistencies and challenges on the technical part. But with assisted supervision, those were at least alleviated. Some of those issues were at least minimized. So as I earlier on mentioned, on a district level, we had like a dashboard for every district where we're just trying to track like the daily progress of a district, and a dashboard for that district might have looked something like this, where within the period of the campaign, we are able to follow or just see the patterns of how data has been entered. And the patterns could actually tell where assistance has to be provided and where encouragement has to also be provided. And on a national level as well, we were just monitoring how the districts were faring during the campaign. And I need to point out here that the campaign is still ongoing. In some districts, both registration and distribution have been done, whereas in some district only registration has been completed and distribution has not yet been started, whereas in some it has been started, but it hasn't been completed, or it has been started, or the data has not yet been synchronized. So the reason why there might be quite a variance on the number of nets that were actually allocated and those that were distributed is mainly because there was quite a shortage of nets against those that were supposed to be received. So there was a lot of capping, which might explain some of the low coverage figures and some of the proportions. The exercise really was a great learning point on how we might want to use DHIS2 to support campaigns, but we did encounter some challenges in our implementation, and one of them was due to a configuration that we had made. So in a way to ensure that the data collected was as consistent as possible, we tried to make sure that as the HSAs are collecting the household information, they should also input the village in which the household is found. So we sort of like collected a very comprehensive list of villages that we have in the country, and we thought of implementing that as an option set. So instead of like opening up the field for free text entry, we wanted them to just like pick from a drop down. And it was supposed to be like a selective drop down that was narrowing down to a particular district. So the HSAs could only see villages that existed in their district. But when we rolled out with this configuration during the pilot phase, we did note that the configuration posed some technical issues. So we had some syncing challenges where the server was getting quite overwhelmed pretty quickly because there seems to be not a very efficient implementation of like very large option sets. So we did abandon that just so that we could support the subsequent exercise of the campaign, because we knew that continuing with that could pose like significant syncing challenges and it would delay the campaign. And one other challenge as well that
Can you finish up in maybe 30 seconds or something? We're a little bit over time on this, and we have another
Yeah,
presenter.
sure.
Thank you.
Yeah, sure, no worries. So then one of the things that we also noted was that the voucher cards had to include like the household unique IDs. And what it meant was that on the day of the distribution, the HSAs had to type this in so that they could retrieve the household unique IDs. But we could think that there would be better support or there would be better workflows if this was incorporating like QR codes that could then be either generated by the system and then they could be printed and taped or pasted on like the voucher card so that on the day of distribution, the HSAs just scan the QR code and it's able to retrieve the record that is associated with that beneficiary. So those are some of the main key challenges that we encountered and possible opportunities for enhancement. So, like I mentioned, this work was supported by the great efforts of our various partners, and we do congratulate them, or we do applaud the efforts that they have put in to make this a success. And thank you, everyone, and thank you, the broader community, for taking time to appreciate the experiences that we have had with using DHIS2 for campaigns. Thank you, everyone. I should pause here for now.
Thank you so much, Ramsey. This was a really great presentation. So thanks for taking the time. I think just due to time, I will just turn it over to HISP Uganda and the Uganda use case. If anyone has questions, please, you can put them in the chat and hopefully Ramsey, you can respond there. And just a note that then we'll let Uganda go a bit over time. So if you have to leave, everything will be recorded and posted on YouTube as well. So yeah, I will just hand it over to Joan and Albert and Prosper from HISP Uganda.
Yeah, thank you very much, Caroline. I would like to request that I share my screen.
Yes, you should be able to. Let me know if not.
All right. I hope my screen is visible.
Yes.
Again, thank you very much for giving us this opportunity to share our use case, as in using DHIS2 for campaigns. HISP Uganda, as a partner, a technical partner of the Ministry of Health, has been supporting the EPI program or the UNEP program since 2018 through the Gavi TCA support that we have. And one of the areas that we cover is real-time campaign planning and monitoring, where we've been able to implement a DHIS2 instance that is basically for monitoring of any other supplementary immunization activities aside from the routine immunization activities. On top of that, we also do general DHIS implementation support for the program, routine immunization data analysis and use, as well as vaccine preventable disease awareness data. Specifically for the campaigns, we support integrated aggregate data reporting for the different campaigns that happen. For those where then there is need to collect individual level data, we are able to support that. But at the end of the day, what the program is really interested in is having this data visualized in real time, and such that that the program can really analyze and do in campaign monitoring, resource reallocation, and any other decisions that may need to be made as the campaign goes on. Just to share context, for the summary of the campaigns we have supported, we started with polio campaign in 2019, and we've so far supported various rounds through 2022, 2023, and 2024, of course, reaching quite a number of children that are under 5, as we can see there. Then in 2021 and 2022, we supported the COVID-19 campaign, where we had 3 rounds of campaigns collecting both aggregate and tracker data, where we are able to get around 19 million records onto this system that is dedicated to campaigns and any other SIS. Then yellow fever, we've been able to support quite a number of phases of yellow fever through 2023, 2024, and 2025. And again, with yellow fever, COVID-19, we've had both aggregate and tracker data being collected. And right now we are planning for phase 3 that is going to happen in April of this year. We've also supported the measles rubella campaigns through 2022, 2023, and 2024. For Ebola, following the outbreak that happened in 2023, and last year, we were able to support Ebola vaccination campaigns in areas that were affected, targeting the populations that were at risk. And then recently, at the beginning of this year, we were able to support the Mpox vaccination campaign within Kampala. And this was strictly tracker data that was collected. Along the support that we are giving the EPI campaigns, we've found some helpful features of DHIS2 that we have leveraged. One of the features being the metadata expiry, or implementing of the end date of some of the metadata, where we see that the program was really interested in different campaign days for different campaigns and different rounds of phases for different campaigns based on the antigen. So this particular feature has come in very handy in that we can just apply an end date to any of the options that is not applicable to that campaign. So we are able to switch on and off. We are able to switch these options on and off as they are needed or when they are required. The other helpful feature that we have made use of is the import-export, where target setting is one of the key needs of the program. These targets are centrally managed and they come from the Uganda Bureau of Statistics. So with these, we are able to format these denominators or these targets and import them into the DHIS2 as and when, depending on the campaign. Yellow fever will have a different target from polio, polio will have a different target from COVID, etc., etc. So this has really been very helpful in having these denominators or these targets set in the system for monitoring. The other helpful feature when it comes to individual level data or tracker data is the scalability of the tracker. Where we started our tracker data collection with COVID-19, we've been able to scale it up to collect yellow fever data, followed by Ebola, followed by recently the Mpox vaccination. So what we do is simply add stages to the vaccination and EFI tracker or e-register that we have on the system. And then we are able to update the same TEI with the information as and when it's available. However, we've also encountered some challenges and also tried to devise some workarounds for these challenges. Starting with the tracker data, where with Android, we have too many clicks. And unfortunately, when you're running a campaign, you don't have the luxury of spending a lot of time because of the volumes of the data you have to handle, the speed at which this data is being generated, and then the level of accuracy that is required for this data. So Android has actually been a bit of a challenge for us to use during campaigns. And that's why when it comes to yellow fever phase 1, aggregate data was amounting to around 9.7 million, and we're only able to record for 5.4 million individual records because of that challenge. Then the inability to do a bulk update. And again, I am very happy to see that there is the role-based data entry that is in progress because we found that that inability to do or update TEIs in bulk was time consuming. It's time consuming to really search and go to every TEI, update their data, even when it is the same data, because you'll find a district has the same, they have the same vaccine, they have the same batch number. For example, yellow fever is only a single dose. It's a first dose and a last dose, but you have to open each TEI and update it every other time. So that role-based data entry, I think, will come in handy here. But otherwise, as HISP Uganda, we had tried implementing a self-registration, targeting education institutions because it was via web portal. So we had to look at people that have internet, people that can read and write and operate phones, and people that can actually navigate the web. So we targeted education institutions to self-register so that the recorder can only update their information in regards to vaccination. The other challenge that we had was visualization. The program needs real-time visualization of this data as it comes in. So we had that challenge, and also a challenge regarding ability to get data from different sources during the time of planning, because this data that is required is really coming from various sources, and we needed to bring it together onto our DHIS2 instance. So we had challenges around that. So I'm going to invite Albert to take us through how we've been able to go through this challenge with real-time data visualization and also ability to get data from various sources. Over to you, Albert.
Thank you, Joanne, and thank you, Tim. I think I'll use your presentation, Joanne, if you...
It's okay, just continue.
Yeah, so we had challenges, like Joanne has said, of having these campaigns, and we couldn't, and for the administrators and those decision makers to view this data, we had to wait for DHIS2 analytics to run, and that would take some good time. So we came up with this very interesting innovation, the Visualization Studio, which lets you display this data in real time. How it works, we use SQL views and in turn create the queries within the application and display this data and create the visualizations within the application itself. If Joanne, you can go to the next slide. We have previous. Next. So we have different we have different features in this visualization studio. One of them is the smart display feature, and this lets the user display charts, sections, visualizations, and even dashboards as PowerPoint presentations, thereby helping in visual storytelling and also better audience engagement. The other feature is public access. This is still in progress, whereby users are able to access this data or some of this data that is actually supposed to be accessed by the public without having to log into the DHIS2. So the administrators or the decision makers can choose which kind of data to display to the public, and the public can go access sort of like a portal and they display that. The other feature is having to display data from multiple sources, including different DHIS2 instances. For example, there are scenarios where you have maybe a target population in an instance, and it is the only maybe metadata that you need from that particular instance. So what happens is that you have to go into that particular instance and display that data from there. So we kind of solved that problem with the Visualization Studio. You can create a single dashboard and you can have data from multiple DHIS2 instances visualized on that single platform. Not just DHIS2 instances, but also other systems and even other sources like Excel, other systems through the API, etc., etc. There's also the fact that we support creation of data sources and visualization of data from different DHIS2 instances. There is also the feature of custom indicator creation. Custom indicator creation, I mean the ability to create indicators from different metadata, meaning that you can have an indicator whereby the numerator, a data element, is from a different instance, and also the denominator, another data element, is also from a different instance, and they come together to create that particular indicator or that data that you need. We also have a feature that that is called the reports. Now, reports is sort of like push analysis, whereby you can schedule, you can create visualizations in this application and schedule and add in different emails and give it maybe a time period. Yeah, give it a time period and say, okay, every after a month, I want the app to send this kind of visualizations to these emails, thereby keeping the administrators and the decision makers and the Ministry of Health in the loop and know what is actually going on. If you can go to the next slide, Johan. So on top of that, we have different visualizations that are not in the DHIS2. For example, the MAQ, it's a moving MAQ, sort of like we have a bunch of single values that are just moving down there. And this helps us to display as much data as we can on a single dashboard, thereby not limiting what we display because of the space. We also have different, multiple chart types, like the tree maps, like the funnel graphs. We have the clock charts, etc., etc. On top of that, the visualization studio lets you add images and icons within the on the dashboard, thereby enhancing both clarity and impact of the data presentation. For example, if you can see that small dashboard down there, you will see that it is talking about TB cases that are notified. It's very small, but I hope you can see it. It is talking about TB cases notified, and it is showing you an icon of a man that is coughing. The other one is talking about severe malaria cases, and it is showing you an icon of a mosquito. So this is a feature in the Visualization Studio that lets you add these images and even the logos of the different partners you might be working on. You might be working with on that particular project that you are trying to deal with. If you can go, John, to the next slide, please. So these are some of the like John had told you earlier, these are some of the dashboards that we came up with. This is for the NOPV that was for the first round. If you can go to the next one. Next slide, please. Yeah, so the Visualization Studio is a DHIS2 application, like I said in the earlier slides. It is also open source. That means that developers can contribute to it. It is also available on GitHub through a link that I'm going to share in the chat. And there's also documentation that is available on how to use this. It is we are still working on this, but it has been developed in the sense that anyone can use it. Anyone that has knowledge about DHIS2 and is actually an implementer of DHIS2 can use it. So you'll find the documentation very easy and the application very easy to use and easy to apply in a particular use case. I've been a little bit very fast because of time, but in case of any questions, we are available to answer those ones. Thank you so much.
Thank you, Albert, and thank you, Caroline. That was all from HISP Uganda. Over.
Thank you so much, Albert and Joanne. Yes, please add any questions in the chat. I will also save the chat and add the questions that haven't been answered to the COP since we're already a bit over time, but everything will be recorded and posted on the COP. So just to quickly wrap up, some next steps around how to be a part of this collaboration and kind of work to enhance DHIS2 for campaigns. So we'll send out an email and probably also on the COP on instructions on how you can test these demoed features. A lot of them are already released as part of our continuous app delivery. For example, the functionality for the dashboard and the data items definitions in the data visualizer. We'll also share the survey for the documentation input and of course the meeting recordings and slides. And please email me if there's anything else. And want to thank you all for joining. Thanks to everyone who stayed a bit over the hour, and thanks so much to our presenters. Really, really appreciate it. And thanks for sharing your experiences in Malawi and Uganda. It's been really interesting. So I think we'll end it there. And again, thanks all, and let's continue talking on the COP. I'll leave the chat open a little bit longer, but I'll stop recording and sharing. Thank you so much.